My name is Zoie Phillips. I am a functional medicine physician assistant, and I have a telemedicine practice out of Wilmington, and it's called UpCurrent Functional Medicine. But I see patients all over the state of North Carolina. So location does not matter as long as you live in the state.
I'm Dr. Andrew Phillips. I work over at Coastal Integrative Health in Leland, right over here in Brunswick Forest. It has also a separate clinic down in Charlotte, the mother clinic, but I do basically physical therapy a lot of the times, but then also the other thing that I've gotten into, which is a new passion, and I think is pretty overlooked, is assessing the organs. I think the organs are a beautiful creation, and I think that they often get overlooked in modern medicine, and so it's something that I've gotten into as of kind of recently, and it's just kind of taken off in a sense.
And we'll learn all more about that tonight,
yes.
for sure.
Can we get started?
Yep.
Cool.
Welcome, come on in. All right, so we just introduced ourselves, and you probably already could tell based upon our names, but we are husband and wife. He's the PT, I'm a PA. I love that we are both involved in healthcare. It's awesome, it's super fun, and it's great being a team with my husband. We often refer patients to one another, so I love that. So I mentioned I do have a telemedicine, functional medicine practice. If you're not familiar with functional medicine, no worries, I'm going to cover that tonight. And my husband mentioned that he works as a physical therapist at Coastal Integrative Health, which is just right around the corner here in Leland. A little bit before we start, Drew, you want to go back a slide?
Yeah.
I received my training as a physician assistant at Murphy-Deming College of Health Science, that's in Virginia, and I went on to receive 2 more functional medicine trainings through the Institute for Functional Medicine and also the School of Applied Functional Medicine. So I have spent the good part of my 20s just furthering my education, but I wouldn't have it any other way. And Drew can tell you a little bit about his training when we get to his portion of the talk. Okay, just a disclaimer, the information tonight provided is not medical advice, it's educational. All right, so what's on deck for tonight? So we're gonna break this up into 3 sections. First section is going to be all about digestion. We're gonna cover some basics, we're gonna cover root causes, and of course, we're going to cover some digestion hacks. Things that you can take away tonight to help you improve your digestion right away. That's what we're talking about. Part 2 is going to be visceral manipulation. Drew is going to share all about that. And then at the end, we're going to have an open question and answer session for both Drew and I. So I encourage you, if there's questions that you have as we go throughout this presentation, maybe write them down and bring them up at the end. We would love to answer them. I think that's the most important way that we learn is by asking questions. So I am looking forward to that. All right, so part 1, digestion, basics, root causes, and hacks. All right, so take a look at this picture. Is this you? Now maybe not all the time, but how about some of the time? Do you suffer from bloating? Do you have heartburn? Do you have that belching after meals? How about gas? We might not want to admit it, but do we experience gas or constipation or diarrhea? These are actually pretty common symptoms. Think about it. Do you suffer from these from time to time? If so, you're not alone. Many people suffer mightily with GI issues every single day, but how many people are truly suffering? Okay, pop quiz. How many million Americans suffer from digestive diseases? Here's a hint for you. There are about 329.5 million people in the US at this current time. So, what do you think? Is it A, 30 to 40 million, B, 40 to 50 million, C, 50 to 60, or D, 60 to 70? Okay, before we go on, let's get some answers. What do we think? A, B, C, or D?
D.
Oh, you guys. Come on. So smart. All right, go ahead. You are right, you smarty pants. It is the 60 to 70 million. And I find that to be astounding. That is almost 20% of the population that's having GI issues. That's incredible. That's a problem. So this is normal, right? Because so many people have GI issues. This has to be normal. Nope. Sorry, not a chance. Just because it's common does not mean that it's normal. And what I love about functional medicine is that we help to uncover the why behind our symptoms, why we develop them, and most importantly, how to reverse them. Not how to prescribe a pill to cover up the symptoms, but how to figure out why they happened and actually reverse them. Okay, so maybe you're wondering, so what is this functional medicine? I've heard about it. Maybe I've listened to a Mark Hyman podcast, or maybe I've read a book and I've heard the term functional medicine come up. What exactly is it? So basically, here's a lovely definition by Dr. Mark Hyman. He is the head of the Mayo Clinic and is probably the most notorious functional medicine figurehead at this time. And he says functional medicine is the future of conventional medicine, but it's available now. And it seeks to identify and address the root causes of disease, and it views the body as one integrated system, not a collection of independent organs that are divided up by medical specialties. It treats the whole system, not just the symptoms. I love that. All right, let's expand a little bit. So functional medicine is also known as root cause medicine. Why? Because we get to the root of symptoms. And in order to do this, we actually look at lifestyle factors, how you live your life. How is your sleep? How is your movement? How is your nutrition, your stress, your relationships, any previous traumas? How about different microorganisms and environmental exposures? They absolutely matter. These are the things that I'm looking at when I'm assessing my patients. This also includes our mental, emotional, and spiritual factors. Yes, that's right. You are more than just a list of symptoms. You are more than just a set of labs. You are a unique human being, and certainly an imbalance in mental, emotional, or spiritual aspects can result in physical symptoms. It also includes genetic predispositions. Many of us are walking around with genetic mutations. Maybe you've heard of the common MTHFR gene mutations. That is definitely very trendy right now. And it also includes experiences, attitudes, and beliefs. There are studies done on our belief system, our mindset, how we perceive our body and perceive our health. Okay, it also, functional medicine also depicts the fact that there can be one condition but multiple causes, and there can be one cause but multiple conditions that can stem from that. So for example, we have the example here, which is depression. There are multiple root causes for depression, and there was a recent study that just came out in the Nature journal. Did anyone catch that? It talked about how the link between depression and serotonin is actually debunked, that it's not just this idea that depression stems from low serotonin. There are so many other factors. Now, all of us here at Functional Medicine, we already knew this, but I'm excited that that conventional medicine is also starting to come on board and realize there are so many more root causes. So for example, omega-3 deficiencies, hypothyroidism, vitamin D deficiency, prediabetes, and yes, antibiotics, because it impacts the gut microbiome, which we'll be talking about tonight. And similarly, inflammation can also contribute to depression, but also things like heart disease, arthritis, cancer, and diabetes. So what about UpCurrent functional medicine beliefs? That is my practice, UpCurrent functional medicine. I believe that the body works together in symphony. I believe that symptoms are the body's way of communicating with us that something is off balance, and that symptoms can manifest from an imbalance in mind, body, or spirit. I believe that there is at least one root cause of every symptom, and oftentimes there's multiple. And I believe that individuals who are willing to address the root causes of their imbalances can heal. I believe this because I've seen it. I've seen it over and over again. I've had patients who came to me saying my conventional provider told me I would never ever cure this particular diagnosis. I would always live with X, Y, or Z. And in working with these patients, we've been able to reverse those dis-ease dynamics. And so that's why I believe it, because I've seen it happen. I do also acknowledge functional medicine is not for everyone. Some people are really happy with the pill for an ill sort of mindset, which I respect. Functional medicine does involve taking a look at lifestyle factors, and not everybody wants to change their life, which I understand. Not everybody wants to change their diet, not everybody wants to move their body, not everybody is willing to accept the fact that their body actually is capable of healing, and that's okay. But I am super passionate about functional medicine because I just believe in the resiliency of the human body. Okay, so how can functional medicine help me with my gut issues? Well, first, let's take a look at some digestion basics so we can lay some groundwork. Now, Drew is going to go into more detail about digestion, so I'm just going to start with a little bit of an overview. All right, so here we have the gastrointestinal tract. Number one, we see the mouth. Is this involved? Yes, it is. So our GI tract is actually this garden hose, so to speak, that goes from our mouth to our anus. And that garden hose starts at the mouth. So how is this involved? Well, we know that chewing, the act of chewing, is what tells our stomach to make stomach acid. So certainly the mouth is important. Then we have the esophagus. That is the muscle that allows for the food that we just chewed up to enter into the stomach. The stomach is where, of course, we have lovely stomach acid, which is super important, and we're going to delve more into that tonight. Super key for breaking down minerals and also amino acids and protein and fats. Super key. Next, we move into the small intestine, which is going to be where a lot of absorption is going to take place. This is where brush border enzymes enter the gut. This is where bile and also pancreatic enzymes come into play, which helps us to break down our food. And then we have the large intestine. And this is where when we often think about the gut and the microbes living in the gut, this is where this is taking place. The large intestine is going to have trillions of bacteria that are going to assist us in digestion. So many amazing things that happen there. That's where we make and metabolize hormones. That's where we, of course, digest our food. That's where we also make things like neurotransmitters like serotonin. 95% of serotonin is made in the gut. Also, over 50% of dopamine is made in the gut. So lots going on in the gut. Also, it's where over 70% of the immune system is housed in our gut, in the enterocytes. So it's a pretty big key player. And then, of course, we have the anus, and that wraps up the GI tract. But there are some other honorable mentions. So we do have the gallbladder. That is a sac underneath the liver that stores bile that is released into the small intestine so we can break down our fats. And we also have the pancreas, which releases digestive enzymes so that way we can further break down our fats and protein. Okay, but what about going deeper? What about going deeper into the small and large intestine? So this is a pretty basic picture that gives us a deeper dive into that wall of the GI tract. Now remember, it's this garden hose. Now when I say the word garden hose, we think about a pretty thick wall, right? Because think about a garden hose. It's, probably rubber, it's pretty thick. Actually, this is not what the wall of the GI tract is like at all. It's actually super thin and super vulnerable. It's made up of a single layer of cells or enterocytes. That makes it very, again, vulnerable, and there are many different things that can happen if that barrier is broken into. We will talk later on about leaky gut. Maybe you've heard of it, it's very trendy, but this is kind of how that, where that would take place. So again, just painting a broader picture of the GI tract and also busting some myths. All right. Okay, so what about some root causes of common GI symptoms? Let's start off with bloating. All right, another pop quiz, get ready. Which is a potential root cause of bloating? Low stomach acid, H. pylori overgrowth, SIBO, small intestinal bacterial overgrowth, leaky gut, also known as enhanced intestinal permeability, or all of the above. I have a feeling you smarty pants are gonna get it. What is it? Yes, all of the above. How did you guys know? How did you know? Okay, way to go. Okay, so let's dive in. So when we think about bloating, first off, what is bloating? Bloating is distension of the abdomen. Now, think about this. Picture yourself on Thanksgiving. You just delved into some lovely turkey, some gravy, some stuffing, the fixings, and what happens? You get tired, and then what might you do with your pants? You might unbutton it, secretly wear a nice flowy shirt over top so nobody can judge you, right? That would be abdominal distension, when you have to actually unbutton your pants to give room for your gut to distend. So that would be bloating. So what are some root causes of bloating? Well, first thing I think of is H. pylori. Does that ring a bell? Does anybody here know what H. pylori is? Anybody brave enough to tell me what they know about H. pylori? It's a bacteria, and what did you say?
In your gut.
Yes, love it. It's actually located in the stomach. Thank you so much. Way to be brave. So this is a bacteria that occurs in low levels in most people. This is still debated to this day, but from what I have deduced, it is present in most individuals. And actually, when there is low stomach acid, H. pylori can overgrow, and of course it wants to take over the world by starting with your stomach. So it can bore its way into your stomach wall. It can decrease stomach acid by turning off those proton pumps in your stomach, and it can even lead to stomach ulcers, and if left untreated, it can actually lead to stomach cancer. So H. pylori is something that can absolutely cause bloating. It doesn't get a lot of airtime in conventional medicine, but in functional medicine, we actually see it pretty frequently. I also, along those same lines, I think about low stomach acid. This is one of my favorite topics because I believe it impacts so much about the gut. We need stomach acid not just to break down our food, but also to absorb key vitamins and minerals. If we don't have enough low stomach acid, that can absolutely lead to things such as vitamin B12 deficiency. Is that ringing any bells for anyone? We need pepsin in order to absorb that vitamin B12, and that's key for energy. Maybe you've heard about people who take B12, maybe they even get B12 shots. A lot of people are deficient in B12 because low stomach acid is rampant. We're gonna learn a little bit more about why and how that can happen, but that certainly can cause bloating. If we're not breaking down our food properly, then certainly the food can ferment in our small and large intestine to cause distension. This is very, very common. What about SIBO or SIFO? Maybe you've heard of that term before. Small intestinal bacterial overgrowth or small intestinal fungal overgrowth. So we can have bacteria or fungus in our small intestine. Now, that's odd, because there should not be a lot of bacteria in the small intestine. It's pretty acidic. It's an acidic environment that does not allow for a lot of bacteria to overgrow. So if you have SIBO or SIFO, which can happen due to a number of reasons, certainly low stomach acid, when you eat food, those bacteria in your small intestine can have a heyday on the bacteria and then poop out different gases that can make you distended. That can cause bloating. What else? We can have poor eating hygiene. What is that? We'll talk more about that later on. Poor eating hygiene, different lifestyle habits that can prevent you from making optimal stomach acid. And don't worry, this is going to be one hack that you can take away from today's talk and start improving your digestion. We will get to it later. Bile insufficiency. You can certainly not make enough bile or release enough bile into your small intestine, which can cause you to not break down your proteins and fats adequately, which can cause bloating. What about constipation? Now, I used to work in the emergency room, and I can't tell you how many people would come in with abdominal pain and with bloating, and we would do x-rays, of course, which would show that the colon is full of stool. Now, we might think this is passé or silly, but the truth is, most Americans are not having regular bowel movements. In functional medicine, we talk about poop. We talk about it every single visit because it matters. We want to have at least 1 to 3 bowel movements every single day. Okay, what about pancreatic insufficiency? Same as bile, we could not produce enough. There are different reasons why we could not produce enough digestive enzymes made in the pancreas or release them properly into the small intestine. Candida overgrowth, also known as fungal overgrowth. Who's heard of that? Candida. Yeah, okay. Most people here have heard of Candida, a fungus overgrowth that can certainly occur in the small intestine, that would be SIFO, or in the large intestine. Certainly, that can cause bloating. Candida or fungus, they feed on sugar. So this is noted by sugar cravings and certainly can cause bloating. And also we have leaky gut. Hey, we heard that before. I showed you that little picture of the cells in the gut and how vulnerable they are to being pulled apart. Those tight junctions can pull apart, allowing things that are supposed to be in the gut to now get into the bloodstream. And that can cause inflammation. This can cause the development of food sensitivities. This can cause systemic inflammation that can travel all over the body to cause joint pain, gut issues, brain fog, anxiety, depression, the list goes on, unfortunately. And certainly can cause bloating. What else? Food sensitivities, we just talked about this. Through leaky gut, when things in the gut that are supposed to stay in the gut get into the bloodstream, we can develop an immune response to food particles, things as benign as green beans or almonds, or think of your favorite foods, sometimes the foods that we eat most often. I see many food sensitivities in my practice, but the real solution is not to take out those foods from your diet and whittle our diet down to nothing. We want to find out why they occurred in the first place, and that involves checking for leaky gut. We also see estrogen dominance can cause bloating. Too much estrogen in relationship to progesterone. Now, women of all ages and men can have estrogen dominance. So even post-menopause, when estrogen levels drop, progesterone levels drop, and testosterone levels drop, we can still have too much estrogen in relationship to progesterone, and that can lead to swelling. The liver is depicted here because that's one area in which the body metabolizes estrogen. Gluten ingestion, this is not a fan favorite, so I apologize if anyone is offended when we talk about gluten, but most people in America suffer mightily, not from a true gluten sensitivity, but from a glyphosate sensitivity. Glyphosate is also known as Roundup. It's a weed killer. Anybody actually use Roundup at some point on their lawns? No judgment. This is very common. If you buy produce in America at a grocery store, unless it has a label on it that says organic, you are getting a genetically modified piece of produce that was sprayed with glyphosate. And glyphosate is a carcinogen, it is estrogenic, and it is inflammatory. And gluten is sprayed heavily with Roundup, and not just on the wheat crops, but also as a drying agent. As it's stored in vats, it helps to dry out the wheat. So we know that gluten can be very inflammatory, and it can certainly cause bloating. I have patients share with me incredible stories about how they feel completely different when they remove gluten from their diet. I am not about removing food groups from our diet, but I am about supporting the health of my patients. And unfortunately, if we live in America and we want to feel different than most Americans, we need to do things differently. We need to be aware of the quality of our food and the things that are being added to it. Okay, so what about the others, right? We just did a deep dive on bloating, but what about things like heartburn? How many people here have suffered from heartburn from time to time and have reached for the infamous Tums? Who has a tub of Tums on their bedside table? Anybody? No judgment here. That's right, it's common. But is this normal? No, it is not. Heartburn is not a natural part of aging. Heartburn can stem from a number of things, but the number one cause of heartburn is not too much stomach acid, it's too little. Now you might be saying, Zoe, that doesn't make sense. Obviously, heartburn is too much stomach acid. I will agree with you, but that is the body's natural response to too little stomach acid. Now, again, low stomach acid is incredibly common, and there are many, many things that can cause low stomach acid. But let's keep in mind, your body is resilient. Your body is fighting for you. Your body wants to meet your needs at every time of the day. So if you are experiencing low stomach acid, you best believe your body's going to try and serve you by increasing your stomach acid. But sometimes our body can overcompensate. And so if there's very little stomach acid and we go to eat, for example, we can get a rush of stomach acid. That can cause us to feel quite unwell when the stomach acid can get up into the esophagus. That's when we start to feel it. Some people can suffer from silent acid reflux, or even suffer from things like Barrett's esophagus, where there's actually changes in the cells of the esophagus, which can lead to things like cancer. So the reality is heartburn often stems from too little stomach acid. It can also contribute to things like H. pylori and be caused by things like H. pylori. But as we discussed, H. pylori overgrowth does stem, truthfully, from too little stomach acid. Heartburn can also be complicated and also be caused by a hiatal hernia. But the big one is too little stomach acid. So, what are some causes of low stomach acid? Zoe, you've been going on and on and on about this. What causes it? Well, number one is acid blocking medications. So that would be things like your Zantac. That would be things like Pepcid. So H2 blockers, H2 blockers, or also proton pump inhibitors. Now, proton pump inhibitors are going to be more significant, and they are going to be a little bit more effective than the H2 blockers, but certainly medications are going to lower stomach acid. And maybe you've been prescribed one. I have heartburn, doctor. Help, what's going on? Here you go, here's a medication. Maybe that is true for you. Poor eating hygiene. We're gonna learn a little bit more about this and the different pillars of good eating hygiene, but certainly different habits that we have during mealtime cannot allow us to produce enough stomach acid if we are in a sympathetic state of fight or flight. Also, hypothyroidism, not enough thyroid hormone, in particular T3. This can definitely cause low stomach acid. Many people are walking around with at least subclinical hypothyroidism. How do I know? I see it all the time. Probably 50% of my patients are dealing with hypothyroidism, but in functional medicine, we're able to look at labs that dive deeper into learning about the thyroid. Our labs are gonna look different. They're not gonna be the same labs that you would get from a conventional provider. So we often find it more because we're using different lab markers, and we have different reference ranges for what is normal, because we want our patients to be ideal, not just what is normal. Now, stress can also cause low stomach acid. Things that can put you into the sympathetic state of fight or flight. That can absolutely suppress your stomach acid. Why? Why would that make sense? Remember, your body is for you. If you are stressed out, your body thinks that you are running from a bear. Your body does not discern the difference between running from a bear and stressing about what your husband said with a group of friends that embarrassed you mightily, okay? Your body does not know the difference. So why would your body want to make optimal stomach acid if you're trying to run from a bear? It wouldn't, it just doesn't make sense. If you're stressed, your body's gonna divert your blood and energy to your muscles so you can run away from the bear. Doesn't that make sense? The body is designed beautifully. Low B vitamins can cause low stomach acid. We talked about that. B12, folate, B6, these are very common. Also, if you have different genetic mutations, sometimes this can lead to even more drastic B12 or B vitamin deficiencies. Age. Unfortunately, this is something that we can't change, but there are ways to mitigate this. Certainly as we age, we do notice that stomach acid does tend to decline, but that does not have to be a crutch. We don't have to just accept that. There are ways that we can mitigate our stomach acid and give ourselves a leg up. And also certain autoimmune conditions can contribute to low stomach acid as well. Now, you'll also notice dysfunctional GI valves is on that list. Now, Drew is obviously going to talk a little bit more about the valves in our GI tract, so just keep that on your radar because you'll be hearing about that next. What about belching? Okay, how many people belch after a meal? It's pretty common. We might not think much about it, but it's actually not normal at all. That can be due to hypochlorhydria, the fancy word for low stomach acid. Also, there's that H. pylori overgrowth again. That can definitely cause belching. SIBO or SIFO, bacteria or fungus in the small intestine where there should not be really hardly any bacteria. Also, overeating. The stomach is kind of like a blender. We don't want to jam pack it full because we're not going to be able to churn the food. How many people have done that? I have. You get overzealous, you're starving, you go to make a smoothie because, hey, it's quick. You stuff things in, and you know what? You're just kind of cramming it down in there. It's not going to blend as well. Same thing is true for the stomach. And also dysfunctional GI valves. There's the valves again. Constipation. If you're not having at least one bowel movement a day where you feel like you're having complete emptying, technically you are constipated. So what can cause this? Low stomach acid. If you do not have enough stomach acid, you are not equipped to break down your food properly in order to allow and encourage regular bowel movements. Here's another one, magnesium deficiency. My favorite supplement of all time. If I was stranded on an island, that's the one supplement I would take with me because I believe it's magical. It does so much for the body. Magnesium is a natural calcium channel blocker, and it relaxes all the muscles in your body, including the muscles of your gut. So a magnesium deficiency is actually quite common. Most people are not getting enough magnesium in their diet, even if you're eating 9 to 13 servings of plants a day. I have a wide range of patients. Some of them eat beautiful, lovely diets that just look picturesque and beautiful, and they're organic, and they're eating so many different number of plants in their diet every single day. I still see some very common ubiquitous nutrient deficiencies in these patients, and that is all thanks to nutrient deficiencies in our soil and in our water. Okay, dehydration. If we're not hydrating, certainly that can lead to constipation. Low fiber intake. We need fiber to encourage bowel movements. Leaky gut, there it is again. It's coming up a lot. When the cells in our gut are spread too far apart, allowing stuff in the gut to get into the bloodstream, this can create inflammation. This can lead to constipation. SIBO, specifically methane dominant. Now, bacteria in the small intestine, there's 3 types: hydrogen, methane, hydrogen sulfide. The methane typically causes constipation. Intestinal dysbiosis, so just a general imbalance of good versus bad bacteria in your gut can lead to constipation. And certainly, you guessed it, dysfunctional GI valves. Can't wait to hear what Drew has to say about that. Diarrhea, okay. So, if root causes of diarrhea would include also SIBO, specifically hydrogen dominant. Undereating. If we're not eating enough food, why would we make lovely formed bowel movements? It's not going to happen. Low beneficial bacteria in the large intestine. Poop is mostly made up of bacteria and food that wasn't digested. That's what bowel movements are. So if we don't have enough of either, certainly that can cause diarrhea. Also, excess magnesium. What I share with my patients is that too much magnesium is going to cause loose stool, and this is how we dose our magnesium. We work our way up on the magnesium until we start to notice a little bit loose stool, and then we back down, and that's how much magnesium your body needs. But certainly too much can cause diarrhea. Parasites. Parasites here in the United States, isn't that like a third world condition? No, it's not. No, it's not. There's a common saying, if you have a pulse, you have parasites. In many other cultures, they do a regular, sometimes 3 or 4 times a year, parasite cleanse because the exposure to parasites is very common through the foods that we eat, especially if you love sushi. Anybody here love sushi? Yes, you are certainly at risk for more parasites, and that can lead to a host of symptoms. Also, anxiety and depression is a big one. And then, of course, dysfunctional GI valves. Drew will talk with us about the different type of valves and which ones in particular could cause diarrhea. Okay, so, you made it. We got through some pretty common GI issues and some root causes. Hopefully your appetite is wet and you're maybe a little bit curious to learn more. How do we find out these different root causes? Well, let's first talk about some easy to use hacks, because I believe that in order to feel better, we don't necessarily need to do testing that costs hundreds or even thousands of dollars. Now, you might see that come up with functional medicine providers. Some specialty tests can get pricey, but I believe in using easy tips and tools and always first focusing on lifestyle factors. So, one easy hack or a list of hacks that you can use to improve your digestion today. So if you go home and have a snack, I want you to think about these tips. And when you have better digestion, you can think about me. Okay, number one, carve out time for your meals. Breakfast, lunch, and dinner. Who actually does this? If you're living in America, lovely. We want to be more like you. Excellent. If you're like most people in America, you are go, go, go. Regardless of your season of life. You may even be retired and still find yourself moving and grooving, booking up your schedule, going, going, going. That is the American way, right? How do I know? Fast food. Fast food. Well, what does that mean? Eating food fast. No, that's bad eating hygiene. I encourage my patients to do things differently. When it comes to meals, put it on your schedule, just like if it were a work meeting. Carve out time, at least 20 to 30 minutes of time allocated just for eating, where you're sitting down and you're prioritizing putting fuel in your body. I commonly tell my patients, your body is like a car. You cannot put gas in your car with the car running, right? What's gonna happen? Bad things. I don't know, never tried it, but it doesn't work, right? You have to stop your car in order to fuel it, and then you can go about your merry way. Same thing's true for your body. Your body needs gas, but it's not going to work well if you are on the go. Now, why is that? Because when we're on the go, we're in that sympathetic state of fight or flight. And remember, when we're in that state, our body thinks we're running from a bear. Even if there's no bear around, our body is not going to optimize digestion and make good stomach acid. It's just not gonna do it. It doesn't make sense. So all of these things are going to encourage you to be in a parasympathetic state of rest and digest. So carving out time for your meals is important. Put it on your schedule. Make time for it. Now, when you go to have your meal, move to a calm spot. Not in your car or at your work desk. Who's guilty? I am guilty of this. Who else is guilty? Yes. We are all guilty of this. No one is going to do these things perfectly. We're human, that's okay. But we're learning a little bit more about these things so we can start to improve our health in natural, easy, intuitive ways. And that includes moving to a spot that is calm, because we want to be calm when we eat. We want to have good stomach acid. We also want to physically sit down. Well, Zoe, that's a no-brainer, isn't it? No. How many of you are preparing dinner, right? And, or maybe you are getting food doled out for other people and you find yourself standing up and eating at the counter. We've all done it, but obviously if you are standing up, your body is still in that sympathetic state. You actually have to sit down. Tell your body that you're resting, and then it can rest and digest. Also, avoid distractions. Turn off your phone, turn off the TV, turn off the radio. Why? Well, because these are things that can put you in that sympathetic state. So if you're watching something scary, if you're watching some suspense TV show or movie, this is no bueno for your digestion. You want some calm Zen music, that would be nice. Maybe the birds chirping, maybe you sit out in your garden and you get to hear the lovely nature sounds. Oh yes, that would be perfect. And also chewing, this is a big one. Zoe, these are no-brainers. I know this, but how many people are actually doing it? Most people chew 6 times before they swallow. That's a bummer, because it takes about 20 to 30 chews in order to really optimize stomach acid. Why? Chewing tells our stomach to make stomach acid. That's the cue. Your body operates on cues. So if you're not chewing, you're not gonna make stomach acid. If you don't make stomach acid, there's a lot of negative sequela that can happen. Poor digestion, low nutrients, and the list goes on and on. And also, setting your utensil down in between bites. I get it, we're hungry, we want to shove food in our face, but that does not allow time for our brain to register that we are full. And this can lead to overeating. And overeating can be like that blender when we stuff it in too full. It's not going to churn. We're going to feel pretty bloated. We might feel like our stomach is heavy. And that's because we don't have enough stomach acid. We overstuffed ourselves. So put the fork down in between bites. Enjoy it. Obviously, you're eating something hopefully that you love, that you enjoy the taste of. I thank God every day for making taste buds. It's awesome, right? Let's enjoy our food, savor it. And also avoid liquids with meals. This is a big one. You go to a restaurant, you sit down, what's the first thing that the waiter or waitress says to you? What do you want to drink, right? Why do we do this? I don't know. It's the bane of my existence. Why? Because liquids are going to dilute stomach acid. And also, this is not common in other countries. Has anyone here done any travel outside of the US and can maybe speak to this? Maybe you have to actually ask for liquids, right? This is certainly common in other cultures. They know that the extra liquid is not needed. Now, certainly, if your mouth is dry, if something's really salty or something's really hot, by all means, drink some liquid. But we don't want to overdo it. This dilutes stomach acid. Most of us go to the restaurant, we sit down, and we drink that big glass of water before our food even comes. No, we've just diluted our stomach acid. No bueno. So, challenge yourself. The next time you go to eat, put the drink behind you and see how often you reach for it. Is it a habit or is it because you're really thirsty? Listen to your body. If you're thirsty, drink. But maybe discern whether or not that's more of a habit. Okay, what else, Zoe? What else can we do? Timing of our meals. Now, this is going to be maybe a little controversial. I believe in the 90s, the craze was eat every 2 hours. You should be eating 6 meals a day. Keep your blood sugar stable, right? Who's heard that? Yeah, exactly, right? Not so good for our digestion. Not so good. Why? Because it doesn't allow the migrating motor complex to happen. What is that? It is like a street sweeper that comes along 90 minutes after you eat to push along bacteria and food particles out of the small intestine into the large intestine. If we are eating frequently, that migrating motor complex doesn't get to happen. And that can set us up for things like SIBO, bacteria in the small intestine where there shouldn't be. So we do want to have time in between our meals. Let digestion happen. Let your body use what you just put in there. Now, obviously, there are ways to optimize your satiety in between meals. This is something I love talking about with patients, making sure we have protein, we have fat, and we have fiber in every meal. You do this, you should not be hungry for at least 3 to 4 hours at least. And also, digestive bitters. Okay, who here has heard about the apple cider vinegar craze? Yeah, people love it, don't they? Why? What are some things that you're hearing from maybe friends or family or people on Facebook? What are they saying about apple cider vinegar?
Lose weight.
It can help you lose weight. Interesting. I would agree with that statement. Why? Because it helps with stomach acid, facilitating stomach acid, which helps with digestion, which helps with nutrient absorption, which helps with homeostasis of the body, which allows for us to shed unnecessary weight. Yeah, it makes sense. Also, studies have shown that it helps with dissolving visceral fat, the fat around your organs. So that can also give the illusion of losing weight. But either way, I'm a fan. I back up this trend, but the reason would be a little bit different. It would be, and the timing of it would be before meals, because that is when we want the stomach acid, not when we're not eating. That can maybe even lead to some acid reflux. We want it before meals. So all vinegars are bitters, such as apple cider vinegar, balsamic vinegar, even the brine of a pickle. So if you want to optimize your stomach acid and support your digestion, pick one of the following. You could add a tablespoon of apple cider vinegar to a half cup of water and drink before a meal. Zoe, you just said don't drink before meals. I know I said that, but this vinegar, the pros of this vinegar will outweigh the cons, and also a half cup is minimal and would also help with the increasing of the stomach acid. Eat one pickle spear before a meal. Who can get down with this one? Yeah, it's pretty easy. A lot of people like pickles, right? We don't fear salt, we fear sugar. Sugar's the enemy, not salt. And then we can start off our meal with a salad dressed with balsamic vinegar. You can add some olive oil, that's lovely. And that will also give you that stomach acid boost that we all need living in this world, in this fast-paced society. This can give us a little bit of a leg up. Okay, are you ready to get to the root of your GI symptoms? There are many modalities that we can use to identify and address the root causes of your GI symptoms. In functional medicine, we look at the whole person. We look at what you eat, how you breathe, how you move, your sleep, your energy, your stressors, your history of previous traumas, your environmental exposures. All of this are things that we assess in order to help us identify different root causes of common symptoms. But we can also use specialty tests to expedite the process. So for example, if we are looking or suspecting SIBO, small intestinal bacterial overgrowth, we can do a SIBO breath test. And in functional medicine, we utilize these specialty tests that are not offered in conventional medicine. Why? Because our training is different, our approach is different. So that SIBO breath test can tell us about what type of SIBO. SIBO is not ubiquitous. There are different types, there's different protocols for SIBO, and certainly we don't just treat it, we get to the why. Why did it happen? And we can also do a stool test. Maybe people have seen ads for different stool tests when they're watching TV. I know Everlywell is a pretty common one these days. I also, in functional medicine, use stool tests, but ones that are accurate, quantitative PCR stool tests like the Diagnostic Solutions GI Map. This gives us a ton of information that we would want to know about the large intestine. Good bacteria, bad bacteria, parasites, worms, inflammation, the leaky gut. We can check a marker called zonulin to tell us about that. And it can also tell us about the stomach. It can look for H. pylori, pancreas by looking at digestive enzymes, and the gallbladder by checking for the amount of fat in the stool, also known as steatocrit. So if you're ready to get to the root of your GI symptoms, consider signing up for a free 20-minute phone consultation with moi. I'd love to talk to you. I'd love to learn about what your health challenges are, what your health goals are, and give you an idea about the approach that we would take to help you reverse your GI symptoms and other symptoms. I don't just help people with GI. I help people with a wide range of acute and chronic illnesses. I have patients that I'm working with to reverse their acne. I have patients that I'm working with to reverse their ulcerative colitis. Wherever we're at on the spectrum, I believe in the resiliency of the human body, and I love the variety. I love working with people with all different types of dis-ease dynamics. So thank you so much for your time and attention. I'm going to move us over to my husband, who's going to tell us all about visceral manipulation. Keep in mind those valves, right? Those valves that we were talking about earlier today. He's going to expound upon them.
Well, it's pretty hard to follow up on that. I mean, that was unreal. Zoe does a really, really good job at explaining things without notes. I'm a little different. I like to have a little bit of notes, but some things do come off the cuff like her. But she is really, really good at what she does, and we work hand in hand together often. So I'm going to go into something about that we've talked about earlier, visceral manipulation. I am a physical therapist. I went to, my undergrad was at Liberty University down in, up in Virginia. I'm used to saying down because I lived in the north so much. And then I went to Newman University for my grad school. That's up in Pennsylvania. It's a little school, a little Catholic school up there. And then I came down here, got a job down here, and then really loved working with Coastal Integrative Health. And I started to fall into a passion, and I got certified in visceral manipulation through the Barral Institute, which is also by the UpLedger Institute. So that is Dr. Gene Barral. He is a well-known DO. Actually, people from all around the world will come and visit him for 15 minutes. They'll fly from all over the world for 15 minutes to come see him. He is $2,000 for 15 minutes. I learned underneath his practice. So this is a very exciting new thing that I'm bringing to this area. I'm the only PT as of now, the only PT in an 80-mile radius that does visceral manipulation. So let's get started with visceral manipulation. So the definition is viscera. The viscera is your internal organs, which can be in the chest cavity, which is your heart or your lungs, or the abdominal cavity, which is your liver, gallbladder, spleen, kidneys, pancreas, small intestine, large intestine, and then stomach, okay? This is a gentle manual approach that helps to produce better movement between the internal organs. So internal organs can get just as much scar tissue built up, and I'll get into that, as maybe, let's say you had a rotator cuff tear. Let's say you had, let's say you broke your leg, and there's some scar tissue in all that area, okay? That scar tissue needs to move for that area to feel better. So our organs are all connected by something, like I said, fascia. This fascia is what holds our organs in place, okay? Fascia is also in between all of your muscles, okay? It's like a web-like, spidery-like type of tissue. Fascia can become restricted for a multitude of reasons. The reason can be from medications, traumas, surgeries, chemotherapy in pregnancies, car accidents, so many other things. So when that fascia becomes restricted, also known as adhesion, it then restricts the movement of an internal organ. As we sit here, we're all taking deep breaths, right? Our diaphragms are all moving, right? It's a little warm in here. I might be speaking a lot, but the diaphragm keeps moving. And as my diaphragm keeps moving, so does my liver, so does my stomach. There are all these ligaments that are closely attached that all work together inherently to be able to move while you're sitting here just enjoying this talk. So when this happens, when something traumatic happens, then the fascia can become restricted, and then those movements become a lot harder to be done. So thoracic and abdominal viscera help to control your breathing, your digestion, your reproductive system, your hormonal responses, and your immune response. So I'll go into a little bit of an example. If I'm pulling my shirt down here, right, and this is the exact spot where I'm pulling down is the scar. That's where the exact scar is. The following tissue around it is all getting pulled around. This tissue, when it's pulled around, is also feeling, you feel that. You don't necessarily notice it, but that means this has to work a lot harder when I have to take a deep breath, right? It's got to pull a lot further. But if I can release some of this and kind of loosen this up, but the scar's still there, you can't break, anyone that tells you they can break up scar tissue is lying. They're lying. Any doctor, anyone, they're lying. You cannot break up scar tissue. It is a formed new tissue, okay? But what you can do is release the tissues around the scar. So that's what visceral manipulation is, and massage. It's really releasing that area that's very filled with tension and kind of helping that to move better. So that's it. We'll go to the next slide. So this is the big GI valve thing. So sphincters. Sphincters are a big buzzword. I'm sure you guys have heard of it at some point. A lot of conventional medicine will kind of overlook this. But it's undeniable. We all learn it in anatomy. We all learn it in where we go to med school, PT school, chiropractor, whatever school you go to, we all know about a sphincter. Sphincters are special circular muscles that open and close throughout the body. Sphincters help regulate fluids and foodstuffs to pass through them. So why are sphincters so important? If a sphincter loses its tone or has too much spasticity where it moves too much, it can lead to laxity in the tissues or overactivity. This is overwhelming the digestive system and can cause a litany of issues depending on the location of the sphincter. So sphincters should move in a clockwise position, okay? Always in a clockwise position. They work 24/7, but they should always be in a normal aspect. They should be working in a clockwise. If they're not working in a clockwise position, then they are dysfunctional and they're going in counterclockwise. Or they're not moving and they're atonic, so that means they're wide open. That means things are just passing through back and forth, but mainly forward. So I always look at this as a huge, huge thing, because what Zoe was saying is all of those connections, belching, heartburn, all these things can be realistically fixed because of a sphincter. And it's really an easy assessment. You sink in, you feel this area, and you feel if it's moving or not. It's really it. It's super easy. Next slide. So here's a pop quiz. Zoe had some quizzes earlier. I thought I'd throw it in too. How many true sphincters are located between the top of the stomach, okay, and before entering the large intestine? How many sphincters are there? Is it A1, B4, C6, or D20? Anyone want to take a stab?
His are harder than mine, guys.
These are a little harder. These are a little harder.
Six.
Ooh, 6. Okay, no, it's actually B. It's actually 4. There's 4 true sphincters in the gut. Okay? So, actually, next slide, babe. So, 4 true sphincters, and I want to kind of highlight them a little bit here. Before I go, I'll get to them, but I actually want to highlight them because that's actually an important thing. There's a cardioesophageal sphincter that's right through here. Okay? Then there's a pyloric sphincter that's right through here. There's a sphincter of Oddi, and then there's a sphincter, the ileocecal valve that's down here. There is also one false sphincter that kind of plays into this part. He has a nice name, but I will get to him in a little bit. The key players in digestion we already talked about. It's broken up, and as you can see in this picture, you see how everyone thinks the stomach is down here, right? The stomach is actually up here, and then the liver's up here, and the liver overlaps the stomach so much that most people are like, oh, you know, I just have this pain in this area, in this area. Well, they're connected. They're connected. The liver and the stomach are connected. Gallbladder, the 4 true sphincters, which we talked about, the 1 false sphincter, small intestine, and the large intestine. So let's get to the, yes. So I want to start with the stomach first, okay? The stomach is located in the left upper quadrant under ribs 9 through 12. Okay, it breaks down our food using digestive juices that it creates in order to pass the food into chyme, into the small intestine. There are 2 major sphincters in the stomach. As you can see right here, there's a cardioesophageal sphincter right here that allows the food to actually go into the stomach so you can actually start to break down that food. And then there's a pyloric sphincter that allows whatever the stomach was kind of massaging into chyme, push that through into the duodenum, which is the small intestine. The big thing with the cardiac sphincter, and what's important, and what I look at is, if I see a ton of people have a ton of issues from it, is they actually will say, oh, you know, I ate some food and I had this burping, belching, or I had this GERD, gastroesophageal reflux, or I had heartburn. Well, then I look at it and I say, let me assess the cardioesophageal sphincter. So based on your symptoms, I can easily start to look at what's going on. I also wanted to bring into perspective, just to show you, because I think it's really exciting that when they open people up in cadaver labs, they have found that the size of the cardiac sphincter is the size of a nickel. So this is how big your cardioesophageal sphincter is. It's actually kind of big if you think about it, and I can actually fit that on my piezoform and I can kind of feel if that's going to open or close correctly. So that's the first piece. Then the pyloric sphincter, that's where your stomach enters into the small intestine, the duodenum. This is an important sphincter because it allows the food that's the chyme to go into the duodenum, and that's the first portion of the small intestine where food continues to get broken down, okay? You think that the stomach does all the work, actually the small intestine does more work too. So it's breaking more food down. So that can also lead to, if the sphincter is not working properly, then that can lead to SIBO, and SIBO, like Zoie said, and SIFO, but I leave that to her expertise. But there are people that have poor absorption because of the pyloric sphincter not working properly. And what I want to say about that is that it's the size of a quarter. So that's the size of a quarter. So you got to think, you got to break down your food this much. First and foremost, you got to break down your food this much for it to get into the stomach. Then it gets chyme, it gets bound up, right? The stomach does its job and it starts pushing through the quarter, okay? So as we go through that process, the next piece to this puzzle is the stomach connections. So when I look at it and I look at the sphincters, that's all great and all dandy. I check the sphincters, make sure they're working properly. Then what I'm looking at is, oh, if I'm getting a little bit of a fascial pull, right, this thing again, then I'm looking at it and I'm saying, oh, the stomach is pulling me somewhere. And I'm looking at it in the aspect of saying, wow, the stomach has a lot of connections. This picture right here shows you all the connections that it has. That's a drawing, but there's a lot of ligaments that come off. The stomach connects to the duodenum, which is the small intestine. It connects to the liver. It connects to the diaphragm. It also connects to the spleen. And then it connects to the transverse colon, or the large intestine. So I'm not just looking at the sphincters, I'm also looking at if there are any ligament attachments. Like if you had a C-section, you open up the stomach and they open up your abdomen, they are moving things around. Your body doesn't forget that. It doesn't forget that. So that scar tissue builds in that area, and then you have to release that scar. Like not release the scar, you can't release the scar tissue, but you can help that fascia move better in the area, okay? So the next one, and this is Zoie has a favorite mineral. I love magnesium as well, but I have a favorite organ. This is my favorite organ. I think the liver is the most unbelievable organ, not because it's just the biggest organ, and it looks like a football in America, but it also is the fact that it is the only organ in the body that can regenerate itself. It's also the only organ that also takes all the blood flow back from all of the other organs and reprocesses it and filtrates it to the rest of the body. So I think that's a very important thing. So what I want to say is it's in the right upper quadrant, it's in the 5th intercostal space, it's in ribs 7 to 12, it overlaps the left upper quadrant and covers the stomach a little bit. It produces bile to break down fats, as Zoe mentioned before, where I already said it purifies the venous blood flow from the surrounding organs, it helps to create red blood cells, and it's a major storage of key minerals and vitamins. I already said it's the largest football-looking organ in the body, and it maintains blood glucose levels by removing blood glucose from circulation when there is too much, okay? So this organ has, and what I want to show on the next slide, is the most attached, like it's the prime player in this situation. So I look at it as it's connected to the diaphragm. People have a hard time taking deep breaths. I immediately look at the liver. Deep breath, liver, because it's connected so much, you can see how much it's connected. Right and left triangular ligament, coronary ligament. I do with every single patient I see in visceral manipulation, I do a liver lift with. I think it's one of the best, and it helps. The body is so amazing. It stores memories where, like, oh, I had a trauma here, I moves. I had a trauma here, and I'm just following this organ, and it's just unloading itself. It's unbelievable. It's like a telephone call. And when I take that telephone call, it answers, and it's telling me where to go, right, left, X, Y, and Z, and then it hangs up the telephone call on me. It's crazy. So then I use kidney. I look at the kidney. It's connected to the kidney. It's connected to the large intestine. The hepatic flexure, exactly on the large intestine, which is actually one of the spots where parasites are. Stomach, it's connected to the duodenum of the small intestine, and then it's connected to the abdominal wall. Okay, so it's one of the most important organs because it has so many connections. The gallbladder, its little brother. So the gallbladder is, how many people have had their gallbladder removed? Okay, everyone that has had the gallbladder removed needs visceral manipulation. That's just a simple T to, like, right there. It is so, when they do that surgery, they just cut and dice, they cauterize, they throw you back, they close you up, it's over with, right? But they don't realize how much damage they really did when it scars. So I'll get into that in a second. It's a small sac that stores bile from the liver, okay? Has a major highway system for bile, okay? It stores bile from the liver and through the common hepatic duct, and then it transports the liver the bile when you're eating fats, and it goes through the cystic duct into the common bile duct, which connects the hepatic duct and the cystic duct. Now, the liver, when you remove your gallbladder, has to work so much harder to produce bile. Okay, the gallbladder is a storage. It's a little sac that stores everything. So you don't have to work. The liver doesn't have to work overtime. The liver's already doing too much. It's already doing too much. So when you put it into perspective that now you took this out, now the liver's got to work harder. There's some scar tissue in there. Now there's some binding down. And I look at it and I say, oh man, we gotta get this right. Also, times doctors don't. I had one of my professors in visceral manipulation. They don't always drain the cystic duct. They don't always drain it. So sometimes what happens, they'll close you back up, send you on your way, and a week later you're back in the emergency room. And you're saying, why am I in the emergency room? And your doctor's like, oh, I don't know, I thought I did everything good. And you're like, yeah, you didn't do it good because you didn't drain my cystic duct. There's one lady, she was my teacher in this course. And when she told me that she went back to the emergency room after she talked to her doctor specifically, because she's a visceral certified therapist as well, she asked him to drain the cystic duct. He never drained it. She was back in the ICU with pancreatitis. And pancreatitis because the pancreas was blocked because this duct wasn't drained properly. Another issue, that's another talk for another time, but the last piece of this is that when we get down to this bottom here is that there is a little connection, and I'm going to show you guys that, but this pancreatic duct connects into a spot that's another sphincter, okay? So this sphincter is a nice funny name. If you walk out of here and you can remember one sphincter, this is the sphincter you should try to remember. It's the sphincter of Oddi, okay? It's a true sphincter. It's majorly impacted and is noticeable when patients have abdominal pain after eating fats. You can also have pale colored stools. The bile duct is usually blocked if that's the case. It's found in the small intestine in the duodenum, which is right here, this little guy. And It is the size of a pea. That's it. So you got to think, this is all you squirt a little bit of bile. You squirt a little bit of bile to break down all those peanut butters, all of those any type of fat that you're pretty much eating. This is breaking it down. Okay. So this little pea right here is what the size of the sphincter of Odie is, not the gallbladder. That gallbladder is a lot bigger. The sphincter of Odie. Small intestine. So I love the small intestine as well. It's one of my second favorite organs as well because it has 3 major portions, and I'll get to those in a second. But the big thing with the small intestine is that it absorbs nutrients and water. There's a continuation of food breakdown, but it really does a huge process in removing 80% of our fluids in our body. The 3 different portions that are there are the duodenum, which I've highlighted a lot, the jejunum, and then the ileum. Okay, so there is a false sphincter, and I'll get into that in just one second. But I wanted to go into each piece. That duodenum, each piece has. Oh, let's go back. Sorry. Each piece has like a specific job. But I want to say that when every single day, 9 liters of water enter the small intestine, or 9 liters of fluid enter the small intestine. The jejunum, which is the next piece to the small intestine, it's the second piece, it actually takes out 7 or 8 liters of water. It's a 22-foot tube that holds the whole small intestine, and it basically helps with, well, I'll go into the duodenum. So the duodenum is the beginning portion of the small intestine. It continues the breakdown of food from the stomach with the acceptance of bile and enzymes. Then the jejunum, that's a muscle now that has to work through segmentation, which is churning back and forth with digestive juice. Okay, that extracts more nutrients and water out. The ileum is the place where peristalsis takes over, where it starts to push food forward into the large intestine. Now, I talked about earlier that there was a DJ flexure. A DJ flexure is the size of a quarter. It's not a true sphincter. Okay, it's a false sphincter. It acts like a sphincter, but it doesn't do the same work that the other sphincters do. The reason is because it's a tube it's connecting. It's a tube that's inside of a tube, but it's a different type of tube. The duodenum, as I said before, is the beginning of a portion where it can handle a lot of fats and bile. It can handle bile, where the jejunum is more muscle and it can't handle bile. But that little transition acts like a sphincter. They don't know why, but it does. It still has an opening and closing, but it's not a true sphincter. It doesn't have like a true close. Alrighty, let's go to the next piece. How many of you guys have started eating and you've had some discomfort in your esophagus? Now, it wasn't heartburn or any type of belching or whatnot, just a discomfort in your esophagus. But you feel like this pulling, and you feel like you couldn't close it or swallow, like it just felt tight in that area. There's a ligament called the ligament of Treates, okay? Treates, however you want to say it. This ligament is a suspensory ligament. It holds the small intestine to the esophagus, and you can see it in green there. Okay, this ligament, if impacted, let's say you had a surgery, abdominal surgery, let's say you had an accident, trauma, car accident, something, and you have it right in this specific area where that duodenum is and that small intestine is and where the stomach is and then the esophagus, and you're going to eat, there could be a little bit of trauma on the ligament of Treates, and that could cause a pulling and a discomfort, a tightness around the esophagus when eating. It's an important thing when I ask patients that come in for visceral. I say, do you have that tightening? Do you feel like, every time I go to take a bite and it just pulls in this area? I look right away, immediately, if you don't have any traumas, at the ligament of Treates. And then I look at the cardiac sphincter and the DJ flexure immediately, because those two are immediately impacted, the two sphincters. Because when you think about it, up there is where the cardioesophageal sphincter starts. It starts to bind down and pulls down. And then the DJ flexure is right there. So that's connected to those two spots. I kind of wanted to highlight that because I feel like that is something that too many times is overlooked. And then they just give you Tums, or they give you any type of medication to just try to push you out the door because you got 8 minutes with your doctor. Next. So large intestine. The large intestine is another 5-foot tube. It helps with mainly absorption of water and electrolytes. So I brought my electrolytes because I tell after every single patient that I see for visceral that they need to be drinking electrolytes, because just like working out, we just worked out all the organs. And so therefore your liver is now gonna be like, oh my goodness, I just worked out, I have to plunge myself of electrolytes, but you need to replenish. So I always tell people that they need to take their electrolytes after. The large intestine is an assister. It can still remove up to 6 liters of water if it needs to, but it's an assister to the small intestine for removing water. So only 10% of daily volume on average. It formates the feces and transports to the rectum, but there is one more very important ileocecal valve, and that is a true sphincter. It's probably the most important one, to be honest with you, after all of them, but it is the size of a dime. So that little guy right here, this ileocecal valve right there, it's only the size of a dime. And if this is often, too often, it's open, it is wide open for most patients. Either is the one sphincter that's hands down the problem. And so I always look at the ileocecal valve as something that I look at pretty much routinely the most immediately, because if somebody's coming in and saying, I'm having diarrhea, it most likely is because of SIBO. And that most likely is because of their small intestinal bacterial overgrowth, and that is most likely because of their ileocecal valve being wide open. So, and then it also could be from pyloric sphincter as a backup between that too. But it is most likely ileocecal valve being open and pyloric sphincter being open, but most likely ileocecal valve, as what I've seen is atonic and it works its way up. The hepatic flexure is right up here, and that connects to the liver, and then you have the splenic flexure, which connects to the spleen. There is also, a lot of times the large intestine can be impacted in causing issues because we remove our appendix. How many times have I had people going in to get an appendix? Who has their appendix removed? Because So right then and there, if you've had your appendix removed, you definitely need visceral, because I'm guaranteeing you that your ascending colon, which is through here, is definitely impacted. And then your cecum's colon is actually impacted as well. So I also look at it in the fact that for women that have had oophorectomies or hysterectomies, if anyone has ever had that done, then the big thing of that is that I look at something called a ligament of Cleyette. It is in 60% of women, and it's a little ligament that comes right through here, and it attaches to your right ovary. Okay, I've had a lot of visceral patients come through, and I'm trying to tell my PT coworkers and colleagues, if you got a woman who is right-sided, hip flexor pain, and it is chronic, and you've done everything you possibly can to fix the iliopsoas, everyone knows the iliopsoas, and it's not getting better, and they've had a hysterectomy and an oophorectomy. That's why we do these. That's why we talk to you before we treat you. It's probably the ligament of Cleyette that was excised, and then now it was excised and it was cut from that ovary on your right side, and now it's causing scar tissue in that area. And what do orthopedic surgeons say? Oh, it's your hip, it's this, it's your iliopsoas. No, it's because they're not looking at the ligament of Cleyette as if I am. I'm looking at the ligament of Cleyette and saying that has got to be worked out. But if you can see here, this large intestine is connected to practically all of the organs, everything. It's connected to the stomach, the right kidney, the diaphragm. So if you have right kidney pain, you could be having it from the large intestine. Diaphragm, spleen, jejunal-ileum, the ligament of Cleyette, liver, gallbladder, duodenum, and the abdominal wall. I mean, the large intestine is connected to practically everything. So, who can visceral help? And I really think I think visceral is for everyone, but is anyone suffering from bloating, gas, constipation, diarrhea, or pain? Is anyone who's had an abdominal surgery, a C-section, like a gallbladder removal or appendix removal or colonic resection, any type of abdominal surgery at all. Anyone who's been in a traumatic event where they either had external or internal damage. I've had people come in where they were flipped in a car accident. The seatbelt got caught underneath their liver, and they were hanging upside down, and they had restriction from that. And that restriction is actually why they're having pain. And so we release that, and they don't have any pain anymore. Anyone with chronic pain, I don't think that chronic pain is just something that your doctor should just write off. Oftentimes they just write you off as maybe you're crazy. I don't think that's crazy. Chronic pain, if I see you, I look at you as holistically, and I will say, let me check this, let me check that, and I try to take it in a holistic approach. There's many times where in my conventional PT practices, I'm saying, hey, I just want to let you know that this could be a reason for you're having this pain. And they either take it or they don't, but I at least want them to be aware of all information, because I feel like far too many times people keep information to themselves. Power is in information, and I think that people need to be educated, and I think that far too often it's a power trip. But I think that chronic pain is something that we have to look at deeply. There are way too many nerves, arteries, veins, muscles that are all connected and intertwined. Specifically, if I'm just talking about that right hip flexor again, the femoral artery, vein, and nerve all run in the same bundle as where the iliopsoas runs, all where the ascending colon runs as well, all where that ligament of Cleat is. And so that's very much overlooked, and I think that's a very important piece. So lastly, the other thing that visceral manipulation can help is anyone who's in a chronic state of fight or flight, that running from a bear, autonomic nervous system fatigue. I tell a lot of people, do you sit when you eat? That's one of the first things I work on. That's their goal. Just like Zoe said, sitting while you eat is the most important thing. Who knows the vagus nerve? That thing is like the most important, it's one of the most important cranial nerves in the body. So if you have vagus nerve issues, you're not going to be able to digest your food properly, which is then going to cause all of your sphincters to be set off, all of your body to be set off. Anyone with respiratory issues, that connection to the diaphragm is so important. So I see a lot of people laboring in their breaths, and I'm thinking, oh, I just want to lift your liver. But I can't lift your liver. And I just say, hey, that's their choice. So that diaphragm is connected to a lot of organs, and you just got to remember that. Anyone with diagnosed parasites or suspected parasites like to hang out in those two little curves of the large intestine, either the hepatic flexure on this side, which is on your liver side, or on your splenic flexure on this side. You can do an easy release that can kind of lift them, pull them out, and just wait for later. That's pretty much how you kind of assess it. But I mean, there's also other assessments that Zoe looks at. But that, in a visceral standpoint, I kind of look at that. And then anyone with IBS, irritable bowel syndrome, that's a very quick, easy word and a label that doctors love to use. IBD is another one, Crohn's disease, celiac disease, peptic ulcer disease, or enterococcygeal, which is a small bowel prolapse. So, and so much more. But as you can see, like I said, I brought all my coins tonight, and I think that's the key is that we got to realize that our body is interconnected and intertwined so much, and the organs are all connected, and then the sphincters all work together. And if something is set off balance, if your homeostasis is not right, it shouldn't be overlooked. And I think it's often too much overlooked. So I thought I would do a little live demonstration just because you guys have been talking about this for a long time. And I want to show a little bit about what I kind of do. I don't know if everyone can kind of see it, but I'll do a little bit on Zoe right here. I think it would be kind of worthwhile just to kind of get an idea. Yeah, everyone, you guys can all circle around if you want. I know COVID and monkeypox and all that stuff, but whatever works for you guys. If you guys want to look, just watch. So I always kind of, when I look at Zoe, or like when I get to a patient, I always take my shoes off first and foremost. But I'm not gonna take my shoes off so you don't have to smell my feet, because it's a grounding process. But essentially, I'm gonna spare her from lifting her shirt. But I usually go skin to skin contact. Cardioesophageal sphincter is usually right around the 7th intercostal space, and that's usually right where the stomach is. Her stomach is right here. Okay, that's it. Her stomach is right there. Liver's right here, and it kind of overlaps the stomach. So I sink into this cardioesophageal sphincter, and then what I'll do is I will wait for her body to either relax or respond. And usually, well, now we have a layer involved, but it's a little more challenging to get a feel on that. But usually what I'll do is I'll start to feel a warmth. It's a deep pressure, a light pressure that is associated with a warmth and a little bit of a beat. And then all of a sudden it will start to twist. And I'll start to be able to move through the cardioesophageal sphincter movement. And then as I feel that, it would feel normal or it would feel not normal, which would be counterclockwise. Clockwise would be normal. I would move down to her pyloric sphincter, which would be coming right, depending on when she ate, would be right or left. But if she ate, and if she hadn't eaten, it'd probably be on the right side. So I'd sink into that again and kind of load the tissue, wait, because these things aren't deep like everyone thinks they are. They're not deep. And then I would kind of load back, wait for it to respond, and then it would kind of rotate and rotate. It's very gentle. And again, it's hard to respond because she has her shirt on. So then we would go down to the next one. I'd go find her belly button, and I'd have her take her 2 fingers from her belly button, and I would go 2 fingers to the left, to the right, to the start, which would be right in here, which would be the, so we did pyloric, now we're going into the sphincter of Odie. Remember, the sphincter of Odie is the size of a pea. At this point, if there is something that I'm pressing on, I usually hear a response, like I usually hear some sounds, I hear some gurgling, okay, depending on if there's either a blockage or a non-blockage or an opening. And then I'll load that tissue again, and then I would go counterclockwise and clockwise. Again, I would have her take her 2 fingers, go here, she'd go a little bit further. I would go into the DJ flexure, which is I would load that tissue again, skin-to-skin contact, wait for it to respond, deeper, light, warmer, and then all of a sudden I'd feel a nice response where it would either turn clockwise or counterclockwise. Again, her belt's in my way, can't get there, and then I would find her McBurney's point. So I would go ASIS, which is her anterior superior iliac spine, and I would go to her belly button. About 1/3 of the way there's your appendix, okay? Just above your appendix is your ileocecal valve. Ileocecal valve is usually right there. I'm feeling with my piriformis, and I would kind of sink into the tissues, and I would wait for a response from the body, and then I would unload, and then it would rotate or not, depending on that. And again, this is all skin-to-skin contact. So you can see cardioesophageal sphincter, pyloric sphincter, working your way down to the sphincter of Odie, working your way down to DJ flexure, and then come down to the ileocecal valve. And then at that point, I would also assess other things depending on where she's having issues. So there's other things that you can do, like a yummy tummy, that help to make the stomach make more acid and help that stomach digest better, which is you basically isolate the stomach, and we'll do that for you guys so you can see, because this one's easy to be done. So if I'm gonna load her stomach, which her stomach will be very happy when I do this, it's very gentle. I'm coming in with the edges of my thumb, and I'm kind of load the tissue, so now I'm on her stomach. And then I'm gonna go ahead and push it, and I'm gonna J swoop, and I'm gonna J swoop, and I'm gonna J swoop, because this little thing is actually gonna help her stomach make more stomach acid. It's also gonna help her stomach digest foods better, and it's also gonna make her stomach feel better when she eats. I have a lot of patients that come in and say, "Can you just do yummy tummy on me?" And I say, "I can't do yummy tummy on you. I gotta do other stuff too." But yummy tummy is pretty awesome. It's a transverse and horizontal movement. So that's yummy tummy. I'll also do a liver lift on Zoe as well. So I'll have you sit on the edge. You can actually sit, that way.
Yeah, I was actually gonna volunteer.
Oh, but a liver lift. Scoot forward a little bit. So a liver lift is quite easy. The liver is right here. How I know that the liver likes what I'm doing is when it accepts more fingers. So I kind of come up